Hey, I'm so sorry about the lighting, but I'm just going to be giving a report on a 23-year-old male that came in today for a head-to-toe assessment. The patient stated his age, which was 23. Um, he was alert and oriented times 3, great nutritional status. He said that he had access to 3 meals per day. His BMI was considered obese. As he walked in, I noticed he had mobility, good mobility and gait, no abnormalities or physical deformities noted, nor does he admit to having any deformities. His posture was upright and straight. He was in a good mood today, and he stated that he is always in a happy mood and stays in a good mood. His natural language is English. He appeared to be clean. He looked like he had good hygiene. I looked at his skin and his hair distribution, color, and texture, and it was appropriate for his race. His skin was warm and dry to touch and intact. His hands were clean. His nail beds were clean. Capillary refill was less than 2 seconds. His grip was strong and equal in both hands. Nails were pink and firm. Negative profile sign. Peripheral pulses, which the brachial and radial pulses were both palpated. They were strong and equal bilaterally. I moved up to his head and I checked his scalp, which was nice and clean. No appearance of manifestations, redness or irritation or dandruff. His hair color was black. The hair was clean. He denied any tenderness to palpitation. No lumps, bumps, or bruises was noted. I then moved down to his face. His face was nice and symmetrical. Cranial nerve number 7, which is the facial nerve, was assessed and intact without any weakness or involuntary movement. Cranial nerves 1 through 12 were all intact. Temporal artery was palpated with no thrills noted. Cranial nerve number 5 was intact, which is the trigeminal nerve. TMJ articulates smoothly. Patient denies any tenderness to the maxillary and frontal sinuses. No pain noted. I then checked his neck. His neck was symmetrical without any masses, tenderness, pulsations. The patient denied any tenderness or pain to pulsations. No. Patient denied any tenderness or pain to palpitation. Lymph nodes were palpable with no tenderness, without swelling or enlargement. I checked carotid arteries, inspection without any lumps or bumps or bruises or thrills. To palpitation, one at a time. They were palpable in auscultation, both bilateral sides were without murmurs and thrills. I checked cranial nerve number 2, which is the accessory nerve. The accessory nerve was intact with full range of motion against resistance. The trachea was midline. I then moved to his eyes. The cornea was assessed from side. The cornea was round and non-concave. His external structures were clear without irritation to the eyebrows. His eyelids and eyelashes. The conjunctiva was nice and pink. The pupil nerve was active. Yes, the pupils were active. They were equal and reactive to the light and accommodation. Cranial nerve number 2 was assessed, which is the optic nerve, and it was intact. Near vision was demonstrated by reading fine print at arm length. I just held up a flashcard and he just read it, so that's how I knew that that nerve was intact. Cranial nerve 3, 4, and 6 was assessed, which is the oculomotor, trochlear, and the abducens. They were all intact without nystagmus. The eyebrows, eyelids were symmetrical without any lesions, redness, or edema. The iris was brown. The sclera was white. The cornea were clear. The eyes were pearl. Then I moved to his ears. His external ears were without any masses, lesions, drainage, or irritation. The patient denied any pain or tenderness to palpitation. The canals were clear. Cranial nerve number 8, which is the acoustic nerve, was intact. The patient heard a whisper and he listened. Everything was heard bilaterally equally. His nose was midline, good patency bilaterally, no drainage noted to the outside of the nose. The mucosa was pink, the septum was nice and midline, no sinus tenderness. The nose was symmetrical without tenderness. Cranial nerve 1 was assessed, which is the olfactory nerve. I then moved down to his lips. His lips were not cracked, no irritation, lesions noted. The mucosa, teeth, gums, tongue, hard and soft palate. The tonsils, they were all moist without exudate. Thyroid was palpated, non-palpable, no tenderness, and it was not enlarged. The buccal mucosa was pink in point. Gums were without inflammation, bleeding, or discoloration. No, actually, my patient did have a little bit of discoloration. Just a little bit. All the teeth were present and in good repair. His teeth appeared to be very healthy. They were white. The hard and soft palates were smooth without lesions or masses. The tongue protruded midline. Cranial nerve 12 was intact, which is the hypoglossal nerve. The pharynx is pink without exudate. The uvula rises on phontation. Cranial nerve 4 and 5 were intact, which is the trochlear and trigeminal nerve. Tonsils are 2 on a 0 to 4 scale. Then I moved down to his lungs and did a posterior inspection with A, P to T diameter. The scapula and spine was midline. I did an anterior inspection. I didn't notice any signs of use of any accessory muscles. Respirations were unlabored and they were 17. I also checked for CVA tenderness when I was doing his posterior check, and it was negative for any CVA tenderness. The patient did not have any pain or tenderness as I palpated. Resonance predominates. I forgot to mention the anterior and posterior lung fields are clear to auscultation with no adventitious sounds to all lobes. Heart sounds sitting and lying were auscultated with no murmurs or thrills. S1 and S2 were heard. I didn't notice any S3 or S4. The heart rate was regular. It was a good regular rate and rhythm. The apical pulse was palpated at the fifth intercostal space, left side right at the mitral valve. The apical pulse was 86 beats per minute. It was regular. I didn't hear any gallops, murmurs, or rubs. The abdomen was then inspected by me. I just looked at it at eye level. I seen good contour. It was a flat symmetrical shape. It was smooth. I didn't see any lesions, scars, or striae on the skin. Like I said, the skin was very smooth. The color was appropriate for the race of the patient. I didn't see any visual peristalsis noted or pulsations noted. The umbilicus was good in midline. Bowel sounds were present times all 4 lobes. Tympany to percussion in all lobes, and negative to light and deep palpitation to all lobes. The abdomen was soft, non-acmegalary masses or tenderness. The lower extremities, I then looked at the skin. The skin characteristics were warm. His hair was evenly distributed. I didn't notice any edema or varicose veins. All peripheral pulses were present and equal. I assessed the femoral, popliteal, the posterior tibial, and the dorsalis pedis pulses. And like I said, they were all palpated with full range of motion. Well, no, they were all palpated. And then I had full range of motion in upper and lower extremities, good muscle strength in upper and lower extremities with a good hand grip. Patient exhibited full range of motion against resistance. I did a heel to shin test, which was negative. I did a patella reflex, which was a positive 2 plus, and a negative for scoliosis screen. I think that's all I got for today. Again, I'm sorry about the lighting. I don't I don't know if I don't think I left anything out. That's all I have for today. Thank you.